I often meet men in my practice who whisper this question with a little embarrassment in their voice. Doctor, is it still okay to masturbate after 50? And I always smile because the truth is, yes, it's absolutely okay. In fact, it can be a normal, healthy, and even beneficial part of your sexual and overall well-being. But here's what most men don't realize. After 50, your body changes. The way your hormones function, the way blood flows, the way your tissues respond, all of it evolves. So, if you keep doing things the same way you did at 20 or 30, you could actually be working against your own body. That's why today I want to talk about how to masturbate safely after 50. Not in some awkward or juvenile way, but as a medical professional who truly wants you to understand your body, protect it, and keep your sexual health strong and vibrant as you age. And I'll also explain the two biggest mistakes that can quietly damage your performance, sensitivity, and long-term urologic health if you're not careful. So, before we dive deeper, let me ask you something. Have you ever noticed changes in your sensitivity? Or maybe it takes longer to reach climax than it used to? Or perhaps your erections feel less firm or more unpredictable? If so, you're not alone, and I'd love to hear your experience in the comments below. Your story might help another man realize he's not the only one going through it. Now let's begin by clearing one of the biggest misconceptions I hear all the time. That masturbation somehow ruins your health after a certain age. That's simply not true. Masturbation itself is not harmful. In fact, moderate self-pleasure can help you maintain healthy blood flow, support prostate function, and release tension, both physical and mental. The real issue isn't that you do it. The issue is how you do it. You see, the male sexual system is incredibly complex. It involves nerves, blood vessels, hormones, and psychological factors that all need to be in sync. But after 50, testosterone levels tend to decline gradually, and blood vessels may become a little stiffer, meaning less elasticity and slower recovery after arousal. This means that the habits you built in your younger years, especially those related to speed, pressure, or frequency, might not serve you anymore. The first thing I want you to understand is that self-stimulation after 50 should be about connection, not competition. When you were younger, maybe you rushed through it, a quick release before work, a fast escape from stress. But as you age, your body doesn't respond to that level of intensity in the same way. Fast, aggressive stimulation can actually train your body to expect unnatural levels of friction or tightness, and that leads to one of the first big mistakes I want you to avoid. Mistake number 1, overgripping or using excessive pressure. This might sound obvious, but it's one of the most common causes of desensitization I see in men over 50. When you grip too tightly, especially for years, you create a kind of conditioning. Your brain starts associating pleasure with that very specific high-pressure stimulation. And here's the problem. Your partner's body, or even your own natural touch during intimacy, can't reproduce that same level of friction. So, what happens? You start noticing that it's harder to climax during sex. You might feel less sensitivity, or you might find yourself needing more and more stimulation just to feel the same level of arousal. That's not because your body is broken, it's because it's been trained. The solution is to retrain your sensitivity. I tell my patients this often. Your body can unlearn bad habits just as easily as it learned them. Start by slowing down. Use lighter touch. Focus on sensations rather than speed. You can also incorporate natural lubrication. Coconut oil, aloe-based products, or simple water-based lubricants can make a huge difference. They reduce friction, protect the delicate skin, and allow you to focus on building connection rather than chasing climax. And don't underestimate the power of your breathing. Deep, relaxed breathing increases oxygen and helps blood flow more evenly throughout the pelvic region. That's key to maintaining strong, healthy erectile tissue. Now, let's talk about mistake number 2, frequency without recovery. This one surprises a lot of men. They'll say, "Doctor, I only masturbate a few times a week. How could that be harmful?" And the truth is, it's not the number alone. It's how your body responds afterward. As men age, recovery time naturally increases. The prostate, the nerves, and even the hormonal system need more time to recharge. If you don't allow that recovery, you can experience a gradual depletion of energy, mood changes, or even temporary erectile fatigue. So what should you do? Listen to your body. If you notice that your erections are weaker the day after, or that your desire feels lower than usual, that's your body saying, "Hey, slow down, I need time to balance." Instead of following a routine or habit, tune in to how your body feels. There's no magic number. It's about rhythm. Some men do perfectly well every other day. Others might feel their best spacing things out 3 or 4 days apart. And remember, there's a big difference between release and connection. If you're using masturbation purely as a stress response, it can become a cycle of temporary relief, followed by fatigue or guilt. But if you approach it as a form of self-care, mindfulness, even intimacy with your own body, it becomes restorative instead of draining. Here's something else I want you to keep in mind. After 50, your prostate becomes an even more important player in your overall sexual health. Regular ejaculation through masturbation or sex can actually help keep the prostate fluid moving, which some studies suggest may support long-term prostate function. But again, the key word is moderation. You don't want to force it. You want to maintain a gentle, natural rhythm that supports blood flow, hormone balance, and emotional well-being. Let's also talk about environment and mindset, because they matter more than you might think. When men rush the process or do it secretly with guilt, they trigger the body's stress response. That spike of adrenaline and cortisol tightens blood vessels and restricts the very flow needed for good erections. So take your time, set a calm environment, maybe even think of it as a meditation rather than an act. When you approach it with awareness, your body responds differently. You'll notice better sensitivity, longer lasting arousal, and a deeper sense of satisfaction. Now, a lot of men ask me if they should stop completely, and I'll tell you this. There's no medical reason to stop unless you're experiencing pain, injury, or significant fatigue. But if you ever notice blood in your semen, persistent pain, or major changes in your ejaculation, it's important to see a urologist right away. These can sometimes be signs of infection, inflammation, or other treatable conditions. Don't ignore them. The earlier you check, the easier it is to manage. Another point I want to mention, as you age, your testosterone levels may fluctuate. That can affect not just your libido, but also how arousal feels. If you notice a consistent drop in desire, mood changes, or reduced energy, get your hormones tested. Sometimes simple lifestyle adjustments, better sleep, weight management, and resistance training can naturally boost your levels. And here's the part most men forget. Cardiovascular health equals sexual health. The same arteries that supply your heart also supply your penis. If you want stronger, more reliable performance, focus on your circulation. Regular walking, less sugar, more leafy greens, staying hydrated, it all contributes. Let's bring this full circle. Masturbation, at its best, is a private expression of health, not a source of shame. It's one of the ways you stay connected to your own body and understand what it needs. But it has to evolve as you do. So here's what I want you to take away. Don't rush, don't grip too tightly, don't overdo it without recovery. Respect your body the same way you would if you were training your muscles or your heart, because in many ways you are. You're training your nervous system, your blood flow, and your emotional awareness to stay in harmony. That's the secret most men never learn. When you slow down and treat self-pleasure as something sacred, something that connects you to vitality, rather than just a mechanical release, you open the door to longevity, confidence, and even better intimacy with your partner. I've seen countless men in their 60s and 70s regain stronger erections and better sensitivity simply by changing their habits. No pills, no devices, just awareness, patience, and consistency. So I want to challenge you. For the next 2 weeks, shift your focus. Instead of seeking release, focus on sensation. Instead of chasing climax, explore control. See how your body responds when you respect its rhythm. You might be surprised how much more alive you feel. And remember, aging doesn't mean the end of sexual fulfillment. It just means it takes a little more wisdom to maintain it. You've earned that wisdom. You've earned the right to feel comfortable, confident, and vibrant in your body. If you've learned something today, or if this message resonated with you, let me know in the comments below. I read what you share, and it helps me understand what men like you are going through, because you're not alone in this. You can age gracefully, powerfully, and yes, even sensually. You just have to listen to your body, protect it, and treat it with care. And if you take one message from me today, let it be this. Masturbation after 50 isn't about youth. It's about health. It's about understanding yourself and maintaining the flow of energy that keeps you alive, focused, and strong. So take care of yourself, treat your body kindly, and never feel ashamed for wanting to understand it better, because the more you know, the better you live. Now let's go even deeper into this topic, because the truth is, your sexual well-being is one of the most accurate mirrors of your overall health. What happens in your bedroom often reflects what's happening inside your arteries, your hormones, and even your mind. So, when men come to me asking, "Doctor, why do I feel less pleasure than I used to?" I don't just look at their genitals. I look at the whole picture. Are you sleeping enough? Are you hydrated? Are you exercising regularly? Are you under chronic stress? Because all of those factors play a direct role in your sexual vitality. Sleep, for example, is one of the most underrated elements of healthy sexual function. During deep sleep, your body releases testosterone. That's why poor sleep or sleep apnea can quietly rob you of your libido and stamina. So, one of the best things you can do for your sexual health, even more than supplements or medications, is to protect your sleep. Aim for quality, not just quantity. A dark, quiet room, consistent bedtime, and less caffeine after noon can make a world of difference. Then there's hydration and nutrition. Blood flow is the foundation of every erection and every pleasurable experience. Dehydration makes your blood thicker, your circulation slower, and your recovery longer. And high sugar diets or excessive alcohol consumption damage the lining of your blood vessels over time, including the small ones in the penis. That's why I tell my patients, if you want better erections, start by treating your heart better. Eat the foods that nourish your arteries, omega-3s from fish, antioxidants from berries, and nitrates from greens like spinach and beets. Your body doesn't separate sexual health from cardiovascular health. They're one and the same system. Now, let's address something that many men hesitate to talk about: pornography. There's nothing inherently wrong with visual stimulation, but when it becomes the only source of arousal, it can create unrealistic conditioning. The brain begins to crave novelty and intensity that real life can't match. And that's why so many men report difficulty maintaining arousal during real intimacy, even when they still respond to screens. If you recognize yourself in that, don't feel ashamed. Just become aware. Take a break from visual stimulation and focus on internal awareness instead. Try what's called sensate focus. It means simply paying attention to sensations without any goal of finishing quickly. Notice texture, temperature, and rhythm. This kind of mindfulness can help you reconnect with your body's natural pathways of pleasure. And here's something you might not expect me to say as a doctor. Pleasure isn't just physical, it's emotional. When you feel calm, confident, and emotionally safe, your body performs better. That's because the parasympathetic nervous system, the one responsible for arousal, can only activate when you're relaxed. Stress, guilt, or performance anxiety instantly shut it down. So take pressure off yourself. You're not proving anything. You're learning, listening, and nurturing your body. That's what real masculinity looks like. Not denial, but awareness. Now, I want to return for a moment to the topic of the prostate because it's incredibly important after 50. The prostate is a small gland that plays a major role in semen production and ejaculation. Over time, it can become enlarged, a condition called benign prostatic hyperplasia, or BPH. This can cause slower urination, frequent urges at night, or difficulty starting and stopping your stream. Masturbation itself doesn't cause or worsen this condition, but staying aware of your prostate health is crucial. If you notice changes in your urination or pain in that region, don't ignore it. Sometimes men come to me only after years of discomfort, thinking it's normal aging. It's not. There are simple medications, therapies, and even dietary adjustments that can support a healthy prostate. And I'll tell you this, the men who take care of their prostate early tend to maintain stronger sexual health longer, because that same gland affects your comfort, your confidence, and your overall energy levels. Now here's another key factor, pelvic floor strength. You've probably heard about Kegel exercises for women, but men benefit from them just as much. Strengthening the muscles at the base of your pelvis can dramatically improve blood flow, erection quality, and even control during climax. To locate these muscles, imagine stopping your urine midstream. That's your pelvic floor. Contract those muscles gently for a few seconds, then release. Repeat several times a day. It's discreet, simple, and effective. With consistent practice, most men notice improvements within weeks. Your erections become fuller, your endurance improves, and your recovery shortens. This kind of training is like tuning the engine. Small effort, big payoff. Now, before we wrap up, I want to address one more thing, shame. Too many men carry shame around this topic, often for decades. Society teaches men to be silent about their sexuality or to treat it as something embarrassing. But that silence creates isolation, and isolation leads to anxiety. I want you to understand something clearly. Sexual health is part of overall health. Talking about it, learning about it, and taking care of it doesn't make you weak. It makes you wise. The more you know, the better you can protect yourself from problems like erectile dysfunction, premature fatigue, or even certain prostate issues. I've had men tell me that this kind of open discussion changed their entire relationship with themselves. They felt more confident, less anxious, more connected to their partners, and even more energetic during the day. Because when you stop hiding from your body, you start working with it. So, if you take one practical action today, let it be this. Give yourself permission to care. Care enough to slow down. Care enough to listen to your body's signals. Care enough to make small adjustments that support your long-term health. That means using proper lubrication, avoiding harsh friction, spacing out your sessions to allow recovery, and staying active to support your circulation. It means maintaining a balanced diet, managing stress, and getting regular checkups, especially after 50. Those small decisions add up to decades of better health, stronger function, and greater confidence. Now, I know this might have been an uncomfortable topic for some of you, but that's exactly why we need to talk about it, because silence never helps. Awareness does. If you've made it this far into the video, that tells me something about you. It tells me that you care about your health, your energy, and your future, and I respect that deeply. So here's my message to you. Don't let aging scare you. Let it guide you. Your body is wiser now. It's slower in some ways, yes, but also more sensitive, more intuitive, and more responsive when treated with respect. You're not losing your masculinity, you're refining it. The same way a fine instrument improves with care and tuning, your body can perform beautifully for years if you give it the attention it deserves. So, take pride in learning about yourself. Take pride in staying informed. And remember, pleasure, health, and confidence are not things that fade automatically with age. They simply evolve. If you take care of your heart, your prostate, your mind, and your habits, you can maintain a fulfilling, healthy, and vibrant sexual life well into your 70s and beyond. And that's not theory. I've seen it over and over in my patients who decided to treat their bodies with understanding instead of frustration. So let's leave it on this thought. Masturbation after 50 is not a risk. It's an opportunity. An opportunity to understand your body on a deeper level, to maintain function, and to stay connected with yourself, but only if you do it with awareness, gentleness, and respect. Avoid the two big mistakes. Don't overgrip and don't overdo it without recovery. Be patient with yourself, stay hydrated, breathe deeply, and let pleasure become part of your wellness, not your stress. And if this message helped you, let me know in the comments. Tell me what you learned, what surprised you, or what you'd like me to explain further in the next video. Because these conversations matter, and together we can change the way men think about aging and health. You deserve to feel alive, strong, and confident in your body, no matter your age. And I'll be here to help you do just that, one honest conversation at a time. Take care of yourself, stay healthy, and I'll see you in the next one.